Hi everyone and welcome to my channel Hobet BB. This video of mine is about atopic dermatitis, that is also known as eczema. Well, it's a condition that makes your skin red and itchy. It is common in children but can occur at any age. Atopic dermatitis is long lasting, chronic condition, and tends to flare periodically. It may be accompanied by asthma or hay fever, that is also known as allergic rhinitis. No cure has been found for atopic dermatitis, but treatments and self-care measures, which I am going to tell you shortly, can relieve itching and prevent new outbreaks. For example, it helps to avoid harsh soaps, moisturize your skin regularly, and apply medicated creams or ointments. Earlier, I posted a short video about atopic dermatitis on this channel. I hope you have already seen that video. And today, I am going to discuss this illness in detail. Well, let me tell you the symptoms first. Well, atopic dermatitis signs and symptoms vary widely from person to person, and these include dry skin, itching, which may be severe, especially at night, red to brownish gray patches, especially on the hands, feet, ankles, wrists, neck, upper chest, eyelids, inside the bend of the elbows and knees, and in infants, the face and scalp. Also, there may be small raised bumps which may leak fluid and crust over when scratched. Thickened, cracked, scaly skin can also occur. Okay, and raw, sensitive, swollen skin from scratching can also happen. Okay. Well, atopic dermatitis most often begins before age 5 and may persist into adolescence and adulthood. For some people, it flares periodically and then clears up for a time, even for several years. You should see your doctor if you or your child is so uncomfortable that the condition is affecting sleep and daily activities, or if you have a skin infection. You should look for red streaks, pus, yellow scabs, and just to find out if there is infection or not. Okay, and if you continue to experience symptoms despite trying different home remedies, then you should seek medical care. Also, you should seek immediate medical attention for your child if the rash looks infected and he or she has a fever. Okay, now let me tell you the causes. Healthy skin helps retain moisture and protects you from bacteria, irritants, and allergens. Eczema is related to a gene variation that affects the skin's ability to provide this protection. This allows your skin to be affected by environmental factors, irritants, and allergens. In some children, food allergies may play a role in causing eczema. Now I'll tell you the risk factor. Well, the primary risk factor for atopic dermatitis is having a personal or family history of eczema, allergies, hay fever, or asthma. On this channel, I have already posted a video about bronchial asthma, and that is also related to this condition. You can see that video. Okay. Now I'll tell you the complications. Well, complications of atopic dermatitis may include asthma and hay fever. Eczema sometimes precedes these conditions. More than half of young children with atopic dermatitis develop asthma and hay fever by age 13. Hay fever is also known as allergic rhinitis, and if you are a regular follower of my channel, you must have seen that video already. If you have not seen that video, you can see that now. Okay, that's very helpful video. Okay, another complication is that you can develop chronic itchy and scaly skin. A skin condition called neurodermatitis, that is a lichen simplex chronicus, starts with a patch of itchy skin. You scratch the area, which makes it even itchier. Eventually, you may scratch simply out of habit. This condition can cause the affected skin to become discolored, thick, and leathery. Skin infection, repeated scratching that breaks the skin can cause open sores and cracks. These increase the risk of infection from bacteria and viruses, including the herpes simplex virus. Irritant hand dermatitis. This especially affects people whose work requires that their hands are often wet and exposed to harsh soaps, detergents, and disinfectants. Allergic contact dermatitis. This condition is common in people with atopic dermatitis. Okay. Also, you may face sleep problems because of too much itching. Okay. And I'll tell you some preventive measures. Okay. The first is that you should moisturize your skin at least twice a day. Creams, ointment, and lotion seal in moisture. Choose a product or products that work well for you. Using petroleum jelly on your baby skin may help prevent development of atopic dermatitis. Also, you should try to identify and avoid triggers that worsen the condition. Things that can worsen the condition, worsen the skin reaction include sweat, stress, obesity, soaps and detergent, dust and pollen. Reduce your exposure to these triggers. Okay. Infants and children may experience flares from eating certain foods, including eggs, milk, soy, and wheat. Talk with your child doctor about identifying potential food allergies. Also, you must take shorter baths or showers. Limit your baths and showers to 10 to 15 minutes and use warm rather than hot water. Take a bleach bath. The American Academy of Dermatology recommends considering a bleach bath to help prevent flares. A diluted bleach bath decreases bacteria on the skin and related infections. Add half cup, that is 118 milliliters of household bleach, not concentrated bleach, to a 40 gallon, that is 151 liter bathtub filled with warm water. These measures are for a US standard size tub filled to the overflow drainage holes. Soak from the neck down or just the affected areas of skin for about 10 minutes. Do not submerge the head. Take a bleach bath no more than twice a week. Also, you use only gentle soaps. Choose mild soap because deodorant soaps and antibacterial soaps can remove more natural oils and dry your skin. Dry yourself carefully. After bathing, gently pat your skin dry with a soft towel and apply moisturizer while your skin is still damp. Okay. Now I'll tell you the diagnosis. Okay. No lab test is needed to identify atopic dermatitis. Your doctor will likely make a diagnosis by examining your skin and reviewing your medical history. He or she may also use patch testing or other tests to rule out other skin diseases or identify conditions that accompany your eczema. If you suspect a certain food cause your child rash, tell the doctor and ask about identifying potential food allergies. Now I'll tell you the treatment. Atopic dermatitis can be persistent. You may need to try various treatments over months or years to control it, and even if treatment is successful, signs and symptoms may return. It is important to recognize the condition early so that you can start treatment. If regular moisturizing and other self-care steps do not help, your doctor may suggest different treatment options that I'm going to tell you now. Okay. Now I'll tell you the different creams that control itching and help repair the skin. Your doctor may prescribe a corticosteroid cream or ointment. Apply it as directed after you moisturize. Overuse of this drug may cause side effects, including thinning of skin. Other creams containing drugs called calcineurin inhibitors, such as tacrolimus, that comes with the name of Atopic, and another drug that is Elidel, affect your immune system. They are used by people older than age 2 to help control the skin reaction. Apply it as directed after you moisturize. Avoid strong sunlight when using these products. Okay. Then there are drugs to fight infection. Your doctor may prescribe an antibiotic cream if your skin has a bacterial infection, an open sore or cracks. He or she may recommend taking oral antibiotics for a short time to treat an infection. Then there are oral drugs that control inflammation. For more severe cases, your doctor may prescribe oral corticosteroids such as prednisolone. These drugs are effective but cannot be used for long term because of the potential serious side effects. Then there is a newer option for severe eczema, and the Food and Drug Administration, that is FDA, has recently approved a new and injectable biological, that is monoclonal antibody, called dupilumab, that comes with the name of Dupixent. It is used to treat people with severe disease who do not respond well to other treatment options. This is a newer medication, so it doesn't have a long track record in terms of how well it helps people. Okay. Now I'll tell you some therapies. Okay. First therapy is bed dressing. An effective intensive treatment for severe atopic dermatitis involves wrapping the affected area with topical corticosteroids and wet bandages. Sometimes this is done in a hospital for people with widespread lesions because it is labor intensive and requires nursing expertise. Or ask your doctor about learning how to do this technique at home. Light therapy. This treatment is used for people who either do not get better with topical treatments or who rapidly flare again after treatment. The simplest form of light therapy, that is phototherapy, involves exposing the skin to controlled amounts of natural sunlight. Other forms use artificial ultraviolet A, that is UVA, and narrow band ultraviolet B, UVB, either alone or with medication. Though effective, long-term light therapy has harmful effects, including premature skin aging and increased risk of skin cancer. For these reasons, phototherapy is less commonly used in younger children and not given to infants. You should talk with your doctor about the pros and cons of light therapy. Also, you can take counseling. Talking with a therapist or other counselor may help people who are embarrassed or frustrated by their skin condition. Then there are some relaxation, behavior, medication, and biofeedback techniques. These approaches may help people who scratch habitually. On this channel, Hobet BB, there are so many relaxing videos in the playlist of music therapy and training. You can see those relaxing videos that can also help you. Okay. Now I'll talk a little bit about infant eczema. Treatment for eczema in babies, that is infantile eczema, includes identifying and avoiding skin irritants, avoiding extreme temperature, lubricating your baby's skin with bath heads, creams, or ointments. You should see your baby doctor if these measures do not improve the rash or if the rash looks infected. Your baby may need a prescription medication to control the rash or treat an infection. Your doctor may also recommend an oral antihistamine to help lessen the itch and to cause drowsiness, which may be helpful for nighttime itching and discomfort. Now I'll tell you some lifestyle and home remedies to help reduce itching and soothe inflamed skin. You should try these remedies which I'm going to tell you now. You should moisturize your skin at least twice a day. Find a product or a combination of products that works for you. You might try bath oils, creams, ointments, or spray. For a child, the twice a day regime might be an ointment before bedtime and a cream before school. Ointments are greasier and sting less when applied. Okay. Also, you can apply an anti-itch cream to the affected area. A non-prescription hydrocortisone cream containing at least 1% hydrocortisone can temporarily relieve that itch. Apply it no more than twice a day to the affected area after moisturizing. Using the moisturizer first helps the medicated cream penetrates the skin better. Once your reaction has improved, you may use this type of cream less often to prevent flare-ups. Also, you can take an oral allergy or anti-itch medication. Options include non-prescription allergy medication, that is antihistamine such as cetirizine that comes with the name of Zyrtec, and then another drug that is Allegra. Also diphenhydramine that is comes with the name of Benadryl may be helpful if itching is severe, but it causes drowsiness, so it is better for bedtime. Also, you should not scratch, but rather than scratching when you itch, try pressing on the skin. Cover the itchy area if you cannot keep it from scratching it. For children, it might help to trim their nails and have them wear gloves at night. Apply bandages. Covering the affected area with bandages helps protect the skin and prevent scratching. Take a warm bath. Sprinkle the bath water with baking soda, uncooked oatmeal or colloidal oatmeal, that is a finely ground oatmeal that is made for the hot tub that comes with the name of Habinos. You should soak for 10 to 15 minutes, then pat dry. Apply moisturizer while the skin is still damp. Also, you should choose mild soap without dyes or perfumes. Use soap that is superfatted and non-alkaline. Be sure to rinse off the soap completely. Use a humidifier. Hard, dry indoor air can parch sensitive skin and worsen itching and flaking. A portable home humidifier or one attached to your furnace adds moisture to the air inside your home. Wear cool, smooth textured clothing. Reduce irritation by avoiding clothing that is rough, tight, or scratchy. Also, wear appropriate clothing in hot weather or during exercise to prevent excessive sweating. Also, you should treat stress and anxiety. Stress and other emotional disorders can worsen atopic dermatitis. Acknowledging those and trying to improve your emotional health can help. Well, on this channel with BB, there are so many videos to relieve stress and anxiety, and there are videos to get rid of depression, and there are so many videos regarding anxiety treatment. You can watch those videos. So this was my video about atopic dermatitis. I hope you like this video, and if you have any question, you can post the question in the comment section. Thanks for watching this video. See you in next video. Bye for now.